Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
severe malnutrition complications. 6 micronutrient deficiency, vitamin A deficiency. So for vitamin A supplementation should be given 50,000 international units for less than 6 months, and the vitamin A, if it is 1 lakh international units, can be given for 6 to 12 months age group, and 2 lakhs international units is given for more than 1 year. Folic acid is given 1 milligram per day, and vitamin K is given as 2.5 milligrams. Zinc is 2 milligrams per kg per day, and
Vitamin K is given 2.5 milligrams. Zinc is 2 milligrams per kg per day.
copper is 0.2 to 0.3 milligrams per kg per day. Iron supplementation is 3 milligrams per kg per day. Iron should never be given in the first week of life.
So in micronutrient deficiencies, vitamin A is given at a dosage of 50,000 international units less per babies less than 6 months. Vitamin A is given 1 lakh international units for babies between 6 to 12 months of age. Vitamin A is given more than 2 lakhs for babies more than 1 year. Folic acid is given in the dosage of 1 milligram per deciliter. Vitamin K is given in the dosage of 2.5 milligrams. Zinc is given in the dosage of 2 milligrams per kg per day.
thank you and thank you for watching.